deadly Ebola outbreak is spreading through Eastern Democratic Republic of the Congo. Health officials are sounding the alarm. More than 246 suspected cases have already been reported. At least 80 deaths have been confirmed so far. Infected travelers have carried the virus across borders into Uganda, raising fears of wider international spread. Emergency teams from Africa CDC and the World Health Organization are now rushing to contain the outbreak before it grows into a much larger crisis. Ebola is one of the world's deadliest viruses. It spreads through direct contact with infected blood, sweat, saliva, and other body fluids. Early symptoms look similar to the flu, including fever, headache, and weakness. The disease can quickly become terrifying, causing vomiting and internal bleeding. It can lead to organ failure and death. Some Ebola outbreaks in history have had fatality rates as high as 90%, making it one of the most feared diseases on Earth. The outbreak is mainly affecting eastern Congo near the Uganda border, especially in crowded regions where healthcare systems are already struggling because of conflict and poverty. Medical workers are facing enormous challenges as hospitals run low on supplies and protective equipment. Authorities are tracing people who may have come into contact with infected patients while trying to stop the virus from spreading into nearby countries. Scientists believe this outbreak may involve the Bundibugyo strain of Ebola. This is especially worrying because current vaccines were mainly designed for the Zaire Ebola strain. This means some treatments may not work as effectively, complicating medical response. Containment becomes even more difficult under these circumstances. Researchers are urgently studying the virus while doctors race to isolate infected patients and protect communities. Ebola outbreaks often begin after viruses spread from infected animals to humans. Scientists believe fruit bats may naturally carry the virus without becoming sick themselves. In remote forest regions, contact with wildlife can trigger deadly spillover events that start human outbreaks. Once the virus enters crowded towns or hospitals, it can spread rapidly through close physical contact and unsafe medical practices.